You take vitamins thinking you're taking care of yourself. But what if one of them is secretly programming your body for a stroke? While you sleep, while you believe you're protecting yourself, your brain, your heart, they may be being sabotaged by something you bought thinking it was healthy. Sounds absurd, right? But I'm going to show you the truth that even doctors don't tell you during appointments. Today, you'll discover the 7 most dangerous vitamins for people over 60, and how the simple mistake of combining the wrong vitamin with the wrong timing can be the silent trigger for a crisis. And the worst part? Everyone is making this mistake. If you're taking supplements, stop everything right now and listen carefully. This information could be the difference between a scare and a tragedy. Like this video, subscribe, and stay with me until the end. What you hear today might literally save your life, or that of someone you love. I'm Dr. Elias Marcondes, a neurologist specializing in brain health and aging. And if I'm here today, it's because I've seen things that left a permanent mark on me. Over the last 15 years, I've closely followed hundreds of older patients who suffered strokes, cognitive declines, or seemingly unexplained neurological crises. And the most shocking part, many of these patients were doing everything right. They ate well, they walked, they didn't smoke, they took their vitamins faithfully, every single day, with discipline, with faith. But what few people knew is that after 60, the body simply doesn't respond the same way. What used to be beneficial can turn into a silent risk when taken in excess or without supervision. I saw a 74-year-old man lose his balance on a sunny morning after taking his heart vitamin. I saw a 68-year-old woman develop mental confusion from a simple bone health capsule. I saw patients with brain hemorrhages who took supplements daily, believing they were protecting themselves. No one told these patients that with age, the liver filters more slowly, the kidneys excrete less, blood circulates differently, and that a vitamin taken at the wrong dose can act like an invisible trigger for collapse. That's why today, in this video, I'm going to show you, with the clarity you deserve, the 7 most dangerous vitamins for the aging brain, and why they can turn into hidden traps for people over 60, even though they're popular and over-the-counter. Each of these vitamins has a history, it has a promise, and it has a little-known side effect, but one I witnessed with my own eyes. And don't worry, this video isn't meant to scare you. It's meant to give you what nobody else has, information with responsibility. You won't have to stop taking everything, but you will learn what to watch for, what to avoid, and above all, when to seek guidance. Because when we understand what the body is asking for, we stop giving it what it can't handle. Stay with me. The first vitamin you're about to learn about is one of the most common, and it might even be in your cabinet right now. Vitamin D. It was a clear Thursday morning. Joseph Harris, 72, was heading to get the newspaper from his front door, like he did every morning. He was active, with no history of serious illness. He walked, read a lot, and he religiously took his morning vitamins, especially vitamin D. He had always heard it was essential for bones and immunity, and since he lived in a region with little sun, the supplement seemed like a logical choice. But that morning, Joseph didn't come back with the paper. His wife found him on the kitchen floor. His mouth was crooked. The right side of his body was weak. Dito Palo Chat GPT. Slurred speech. Everything happened in silence. The diagnosis, ischemic stroke. A clot blocked blood flow in the brain. But why? He took care of himself. He was disciplined. He did everything right. What we discovered in the clinical analysis was shocking, and unfortunately, increasingly common. Vitamin D, while essential, is a fat-soluble vitamin. That means it accumulates in the body, especially in the liver and fat tissue. Unlike vitamin C, which the body excretes easily, vitamin D stays in the system and can exceed safe levels if taken in excess. And too much vitamin D increases calcium absorption in the body. Sounds good? Not always. Excess calcium in the blood can deposit on vessel walls, hardening arteries and causing hypertension. Additionally, it promotes the formation of clots, especially in people who already have circulatory tendencies, which is common past age 60. Recent studies show that more than 40% of older adults taking vitamin D supplements unknowingly exceed the ideal dose. Most take it without any blood level testing, and many pair it with calcium, a highly inflammatory combo if improperly dosed. Another critical factor: vitamin D is often taken at night, precisely when metabolism slows down and blood clotting is more active. This habit increases the risk of clot formation during sleep. If you need vitamin D supplementation, do it under medical supervision. Always take it in the morning and never exceed 800 IU per day unless a test confirms a deficiency. And don't add calcium automatically, only if your doctor prescribes it based on your blood work. Today, Joseph uses a cane and goes to physical therapy each week. But what hurts him the most isn't his dragging leg. It's the phrase he repeated to me, eyes filled with tears. "Doctor, I just wanted to protect my bones. I didn't know I was killing my freedom." 2. Vitamin E misses. Nair, 76, had always been very vain. Well-groomed hair, manicured nails, a smile on her face. She said she wanted to age with elegance, inside and out. So every day, she took her vitamin E capsule. She claimed it was antioxidant, rejuvenating, good for the heart. But one day, while showering, everything changed. She began feeling dizzy. She dropped the towel she was holding, and within seconds, her body slid and she hit the cold floor hard. At the hospital, the news was tough. A mild brain hemorrhage. A small blood vessel had ruptured, causing bleeding in her brain. Nothing indicated this could happen. She wasn't on blood thinners. She didn't have high blood pressure. But when we looked into her habits, a possible cause became clear. Vitamin E, although known for its antioxidant benefits, has a little-known property. It thins the blood. Yes, it interferes with clotting, and when taken in high doses or alongside other natural or pharmaceutical anticoagulants, it significantly increases the risk of internal bleeding, especially in the brain. This is particularly dangerous for people over 60 because their blood vessels are naturally more fragile and their circulatory volume control becomes more delicate. In a study published in the Journal of the American Medical Association, older adults who took high doses of vitamin E for long periods faced a 13% increase in the risk of serious hemorrhages. The recommended daily dose for adults is 15 mg, or 22.4 IU. But many over-the-counter capsules contain 400 IU or more, almost 20 times the actual needed amount. On top of that, vitamin E is found in multivitamins, vegetable oils, and other foods. Accumulation can occur without the person even realizing it. Stop taking vitamin E on your own and talk to your doctor. Don't take it if you're already on aspirin, anticoagulants, or omega-3 supplements. Never combine them without medical guidance. Remember, more is not better, especially as you age. After weeks in the hospital and extensive physical therapy, Mrs. Nair regained most of her movement. But one day, when she saw me in the hallway, she held my hand and whispered, "Doctor, I just wanted to preserve my youth, but I almost lost my mind." If that surprised you, wait till the next chapter. The next vitamin can slowly destroy peripheral nerves without pain until your body begins to fail. 3. Vitamin B6. Mrs. Ruth, 69, always had steady hands. She sewed, embroidered, and tended plants with the care of someone who respects time. But over the past few months, something strange began happening. She dropped scissors without realizing it. Then she started feeling tingling in her fingers. And over time, her hands began to tremble until her feet started failing and her balance became unstable. At first, she blamed it on getting older, but tests revealed something alarming: progressive peripheral neuropathy. The cause? A vitamin she took daily, with faith, consistently: vitamin B6. Vitamin B6, also called pyridoxine, is essential for metabolism, brain function, and nerve health. But in high, long-term doses, it becomes neurotoxic. In other words, it starts attacking exactly what it was supposed to protect. B6 toxicity works silently. It damages the myelin sheath, the protective covering around nerves. Without it, the electrical signals between brain and body become weak or uncoordinated. The result: tingling, loss of coordination, numbness in extremities, difficulty walking, and in severe cases, partial paralysis. The safe intake for older adults is about 1.5 mg per day, but many supplements contain 50, 100, even 250 mg, over 100 times the daily requirement. As we age, The body can't eliminate the excess as easily, and chronic exposure leads to toxic buildup in nerve tissue. Plus, B6 is included in many multivitamins, B-complex formulas, and mood or sleep supplements. Often, the total intake goes unnoticed. Avoid taking single-ingredient B6 supplements over 2 milligrams per day, unless clearly prescribed. Be wary of vitamin blends promising energy, focus, or hormone balance, as many contain hidden megadoses of pyridoxine. If you experience frequent tingling, weakness, or imbalance, stop using it immediately and consult a neurologist. Today, Mrs. Ruth is sewing again, but slowly. She shared with a shy smile, "Doctor, I thought I was nourishing my body, but unknowingly, I was unplugging my own wiring." 4. Vitamin A. Mr. Alcho always took great care of his eye health. At 73, he loved reading, doing crossword puzzles, and proudly said he could see better than many young people. So every day he took his vitamin A. "They say it's good for your eyes," they told him, and he believed it. But over time, headaches began to appear. His vision was blurry in the morning. He felt a strange pressure behind his eyes, as if something was pushing from inside out. Sometimes he heard a persistent ringing in his right ear. As a precaution, her daughter insisted on an MRI, and that's when the shock came. Increased intracranial pressure, a condition that mimics a brain tumor. Except there was no tumor. The cause was elsewhere, accumulated excess vitamin A. Vitamin A is essential for vision, skin, and immunity. But it's a fat-soluble vitamin, meaning it accumulates in the body. The body doesn't easily excrete it. It deposits in the liver, and in excess, disrupts the pressure balance inside the skull. This condition is known as pseudotumor cerebri, or idiopathic intracranial hypertension. Symptoms include constant headaches, blurred vision, ringing in the ears, nausea, and, in severe cases, progressive vision loss. The problem is that symptoms are vague at first, and many older adults attribute them to normal aging. The recommended daily allowance of vitamin A for older adults is 700 mcg for women or 900 mcg for men. But many supplements, especially those marketed for skin and vision, contain 5,000 to 10,000 IU, which equals up to 3,000 mcg per dose. Prolonged intake of that amount can lead to liver toxicity and neurological changes. Additionally, vitamin A is present in many fortified foods, and many people unintentionally combine it with other supplements, like multivitamins or cod liver oil capsules. Avoid any vitamin A supplement exceeding 900 mcg per day unless prescribed by a physician. Opt for natural sources instead, such as carrots, pumpkin, mango, and dark leafy greens, which contain beta-carotene, a safe, body-regulated form. If you feel pressure behind your eyes, experience frequent migraines, or wake up with blurred vision, see an ophthalmologist or neurologist. It may not just be fatigue. After a long treatment, Mr. Also regained stable vision, but he never forgot what he went through. "Doctor, I thought I was protecting my eyes, but I didn't see the danger I was bringing to my own hands." 5. Niacin, vitamin B3. Edmundo's story at age 70 begins with a promise. He wanted to control his cholesterol naturally. Avoid statins. Take care of the heart without heavy chemicals, he said. That's when he discovered niacin, the famed vitamin B3. He read that it helps lower cholesterol, improve circulation, and boost energy. So he started taking it on his own, without a prescription, without supervision. In the first few days, he felt his face flush. Then hot flashes came, as if he had a fever. He thought it was normal. But one ordinary afternoon, his head began pounding, and the left side of his body went numb for a few seconds. It seemed like everything returned to normal, but something had changed. The test revealed he had experienced a mini ischemic stroke, a transient attack to the brain. Small, silent, but dangerous. And the trigger was likely the high-dose niacin. Niacin, B3, is vital for metabolism and vascular health. But in therapeutic doses, like those sold for cholesterol control, it can cause excessive vasodilation and blood pressure instability. This means blood vessels suddenly dilate, causing blood pressure to spike and drop rapidly. These abrupt changes are extremely dangerous for the aging brain, whose vessels are already more fragile and have less self-regulation capacity. Additionally, excess niacin can interfere with blood sugar control and liver function, impacting multiple bodily systems at once. Natural niacin doses found in food are small and safe. The recommended intake for adults is about 14–16 milligrams daily. But supplements marketed for natural cholesterol control contain 250 to 1,000 milligrams per capsule, over 60 times the daily requirement. And the worst part, many older adults take them alongside other vasodilators, unaware they're combining side effects like dizziness, falls, and stroke. Never use extended-release niacin without a prescription. It can be beneficial, but only under strict medical supervision. If you experience sudden warmth, facial flushing, headache, or dizziness after taking a supplement, stop immediately and seek medical evaluation. And remember, just because it seems natural doesn't mean it's safe for your heart or brain. Today, Edmundo is under medical care and doing well. But he told me firmly, "Doctor, I wanted to stay away from meds, and I almost fell into a vitamin trap." 6. Folic acid, vitamin B9. Mrs. Marilia, 75, had an enviable memory. She told stories with vivid detail, remembered every family birthday. She was known as the neighborhood's living library. Then suddenly something began to fail. She forgot simple names, misplaced objects, repeated stories she had just told. Her daughter, concerned, took her to a neurologist. Tests were done, and one finding stood out: extremely high folic acid levels, vitamin B9. At the same time, a serious vitamin B12 deficiency. How could this happen? The answer lies in a dangerous, little-known effect. Folic acid can mask B12 deficiency symptoms, allowing neurological damage to progress, without noticeable signs until it's too late. Folic acid is essential for blood cell production and DNA repair. But in high doses, it artificially corrects B12 deficiency anemia, without addressing the neurological damage caused by low B12. In practice, the person appears better, blood tests look improved, but the brain quietly loses neurons. B12 deficiency is common in older adults for several reasons: reduced absorption in the stomach, use of omeprazole or metformin, low animal protein diet. When B12 is low, its symptoms can mimic dementia, forgetfulness, mental confusion, disorientation, mood changes. But if folic acid is elevated, it masks these warning signs, and the damage becomes irreversible over time. The ideal daily dose of folic acid for adults is 400 mcg. However, many OTC supplements contain 800–200 mcg per capsule, especially those labeled for women's energy, memory, or B complex. Plus, many processed foods are fortified with folic acid, and cumulative excess is common, especially among older adults who rarely eat meat. Before taking folic acid alone, check your B12 level first. If you're older, vegetarian, or on chronic antacids, there's a high risk of B12 deficiency. And never take more than 400 mcg day without medical recommendation. Ideally, always supplement B12 alongside, preferably methylcobalamin, and under medical supervision. 7. Multivitamins. Mrs. Louisa, 74, took a colorful pill every day. She said it was a complete vitamin, everything your body needs in one capsule. She didn't question it, didn't read the label. The marketing felt reassuring, but over time, hard-to-explain symptoms began to appear. Blood pressure fluctuated, urine became dark and foamy, memory lapses happened at unexpected moments, and tests revealed signs of kidney and liver overload. Gradually, they discovered that the complete vitamin she was taking contained accumulated doses of nearly every nutrient she already got from her diet, and more, doses far too high for her age, weight, and body. Multivitamins are marketed as a quick fix to prevent deficiencies, but in reality, they are not personalized. They are generic formulas, often based on the needs of young adults, and don't account for the changes in an aging body. They contain high doses of fat-soluble vitamins, like A, D, E, and K, that accumulate in the liver, megadoses of B6 or B3, which can cause neurotoxicity mixes of minerals that interfere with the natural absorption of other nutrients, dyes and additives that increase toxic load on kidneys and liver. The result is a silent cocktail, which, instead of protecting, can unbalance the body across multiple systems at once. And the worst part, many older adults take a multivitamin on top of omega-3, B complex, and vitamin D, not realizing they're doubling or tripling substances that become toxic in excess. A Johns Hopkins University study involving over 400,000 people found that regular multivitamin use did not reduce the risk of death, heart disease, or cancer. It warned that, in some cases, it may increase the risk of adverse effects from excess. In older adults, the ability to metabolize and excrete nutrients is reduced, which increases vulnerability to liver overload, kidney stones, arrhythmias, and mental confusion. If you take a multivitamin out of habit, stop and reassess. Take inventory. What are you already getting from your diet? Which supplements are you using? Even more importantly, get blood tests before taking any complete supplement. Your body doesn't need everything every day. It needs the right things, in the right dose, at the right time. The truth is, you've aged, and over time, your body has changed. What once helped can today overload it. What once seemed harmless can now be a silent trigger for something bigger. But this isn't your fault. You trusted. You did what everyone said was right. You took vitamins to protect, to maintain energy, to live better. But no one told you that after 60, your body absorbs differently. Your liver filters more slowly. Your kidneys excrete less efficiently. Your vessels are more fragile. And while you believed you were taking preventative action, you might have, unknowingly, opened the door to imbalances that don't show up right away. Here's the thing. You are not alone. Thousands of people your age are discovering what it means to take care of health consciously. No excess, no fads, with knowledge. The good news? You still have time. You can still take action. You can protect your brain, your heart, your independence. And it doesn't start with a pill. It starts with a simple question. Do I really need this? Because true care isn't about quantity. It's about quality. It's about listening to your body. It's about choosing wisely, not out of fear or because of marketing. And if you've watched this far, it's because something inside you is already awakened. Maybe a memory of a family member who went through something similar. Maybe a symptom you felt but didn't understand. Or maybe it's just your instinct telling you, now is the time to pay attention. And it's a good thing you got here, because now you know what few people know, and you can make better decisions for yourself and for those you love. If you'd like, write in the comments. I now know that not every vitamin is good for me. That simple phrase could help others still trapped in the same illusion. And if you feel this video opened your eyes, share it. There are many out there taking something they believe is protective, but it could be poison. Now that you know the truth, don't let this information die on the screen, because your health can't wait. Your brain, heart, kidneys are asking for a new kind of care, more attentive, smarter, more attuned to you. So jot this down, with care, with awareness. 4 actions that can turn your health around. 1. Take inventory of your supplements. Grab a piece of paper, open your drawer, your shelf, your cabinet. Write down everything you're taking. Vitamins, capsules, complexes, fortifying teas. Now look with fresh eyes. Is anything duplicated? Is there anything you're not sure why you're taking it? Is any label over 100% of the daily value? Even that simple step starts protecting you. 2. Get tested and don't accept. That's normal for your age. Tell your doctor clearly. I want to know my levels of vitamin D, B12, iron, folic acid, and kidney and liver function. If they brush you off, insist respectfully. You have the right to information. Your body deserves care based on data, not guesswork. 3. Trust less in the label and more in your body. Those bottles look nice. They promise energy, youth, memory, but they don't know your history, your weight, your routine, your other medications. So before trusting what's written, learn to trust what you feel. Unusual fatigue, dizziness, sudden warmth, foggy thinking, strange urine. These are signs. Your body speaks. Listen. 4. Share this video with someone you love. It could be your husband, sister, a friend from church, a neighbor. Many people are living the same risk, but in the dark, you can be the light that wakes them up. You might save someone from something that didn't even look like a problem. And remember, knowledge doesn't weigh you down. It has no side effects. It doesn't poison. On the contrary, it liberates, it protects, it transforms. You still have time. You can still protect your memory, your body, your life. And it doesn't start with fear. It starts with information and with love for yourself. Because aging doesn't have to be a shock. It can be a path of awareness, of wiser choices, of presence. If you've made it this far, it's because something in you wants to live well. And that something deserves respect. So take care of yourself with kindness, not out of alarm, but out of clarity, not out of obligation, but out of self-worth. And remember, it's never too late to start again with more wisdom. If you want to leave a sign that this video touched you, write in the comments, "I choose to age with awareness." And if you can, subscribe to the channel. Here, your health is taken seriously. Here, you are seen and respected. See you in the next video.